Hello. Age-related macular degeneration, or AMD, is the leading cause of blindness in first world countries. AMD is a long-term eye condition affecting the central part of the retina called the macula. This part of the eye is responsible for central detailed vision. With aging, yellow deposits can build up in the macula and disrupt the way it works. As the AMD progresses, it is either dry AMD or wet AMD. In wet AMD, you may suddenly get blurred vision, distorted vision, or a blind spot in your central vision. This is caused by abnormal blood vessels that form under or within the macula. They leak fluid, hence the word wet, and bleed at the back of the eye. This may permanently damage and scar the macula. If this fluid is left untreated, your central vision will get worse. Wet AMD can progress rapidly and cause significant loss of vision in as little as 3 months. In dry AMD, the macular cells slowly deteriorate over many years. The term dry does not mean that you have dry eyes, it just means that the condition is not wet AMD. In severe cases, AMD can have a significant effect on your quality of life. It can prevent you from working, driving, reading, and carrying out your normal daily activities. It can also prevent you from recognizing your friends and family. To prevent AMD, or the progression of AMD, you should avoid smoking, monitor and treat your blood pressure regularly, lead a healthy lifestyle with plenty of exercise, eat a balanced diet high in green vegetables, and maintain a healthy weight. According to a scientific study called Age-Related Eye Disease Studies 2, if a healthy diet is not possible, vitamin supplementation containing lutein and xanthines can offer some protection. This is if you have higher than normal risk, such as lost vision in one eye. For most AMD patients, there is no proven benefit to vitamin supplements. Active wet AMD can only be managed by regularly monitoring the fluid in the back of your eye. This may include injection treatments with anti-VEGF medicine to reduce the growth of blood vessels. Unfortunately, there is currently no treatment for dry AMD. However, vision is not as badly affected for most people with dry AMD. Regular sight tests for glasses, as well as good lighting, can help. If you're severely affected, low visual aids are available from the NHS to support you with your daily activities. If you're not currently on active injection treatment, you should monitor yourself for any changes in vision. Check for distortion by looking at the straight vertical edges of things such as doors or window frames. Some professionals recommend using an Amsler grid or chart to monitor any changes in your AMD. These are small squares with black horizontal and vertical lines on a white background. Look at an Amsler grid once a week or twice a month and check for distortion or waviness or a disappearance of part of the grid. If there are noticeable changes in the Amsler grid or decreased vision, please immediately report this to your GP, optometrist, or hospital eye care team. You must inform the DVLA if you are diagnosed with AMD in both eyes. If you are a professional driver, you will need to inform the DVLA if you are diagnosed in one eye. Please ask a member of the ophthalmology team for more information about your case. Ask your hospital specialist, the eye clinic liaison officer, or your optometrist about local accessible support groups. Contact the Macular Society and Diabetes UK to find out what support is available. They are really valuable charities offering incredible support and advice for people with AMD.